begin with, dental hygiene is a state or practice of keeping the mouth cavity in a healthy condition. To keep good oral hygiene, it is important to brush morning and night and floss daily. It's also very important to visit the dentist at least every 6 months. Brushing your teeth is vital because it helps remove the plaque and buildup from the teeth. It is important to know how to properly brush your teeth so that it is beneficial to you. This video coming up will show proper brushing techniques.
Whenever brushing your teeth, you want to make sure to brush 2 times a day. And it's also important to brush for the full 2 minutes whenever you brush, because your main goal in brushing is to remove plaque and buildup that's on the teeth. When you start brushing, you want to make sure to get every side of every tooth. And when you start brushing, make sure to aim towards get the back teeth first. We're going to start on the inside and the outside of the upper and lower teeth. When you angle the toothbrush, you want to make sure to get it at about a 45-degree angle to the gum line, because this is mainly where the plaque buildup gets on the teeth. Whenever you start brushing, start at the back and start doing small tooth-sized circles, gradually moving forward. You want to make sure when you're brushing not to do a harsh back and forth motion, because this can cut the gums. But continue to do the small tooth-sized circles along the gum line. It's the motion that removes the plaque. You're going to do the same for the lower arch. Aim the bristles towards the gum line, do the small circles. And you're going to do this all the way around, same with on the inside of the teeth. Same 45-degree angle, small circles all the way around. And when brushing the chewing surfaces of the teeth, you want to make sure to hold the toothbrush flat on the chewing surface and go back and forth. This removes the plaque from in between the teeth. Also, whenever you're brushing the anterior teeth, you might try using the toe of the toothbrush, which is the tip of the toothbrush. It allows easier access into these areas than trying to fit the brush in horizontally. So turn your toothbrush vertically, still aiming the bristles at a 45-degree angle, and doing the small circles all the way across on the inside, and then also on the upper arch, doing the small circles. And this whole process should take about 2 minutes. Adults and kids should all brush for that amount of time. And you want to make sure to brush your teeth in the morning after you have breakfast and at nighttime before you go to bed. And this prevents plaque buildup.
Next time you brush your teeth, try to remember all the things she said about brushing properly. It would also be a good idea about brushing your tongue, especially in the mornings, to get rid of bad breath. Although flossing may not seem as important, it really is. I used to think flossing was just to get in between the teeth, but it's also to get underneath the gums where the toothbrush can't. In the following clip, you will see how to properly floss your beautiful teeth.
Are you looking for a great form of method on how to correctly floss your teeth? Well, my name is Michelle and I'm a dental assistant with Solutions, and I'm going to demonstrate to you on how you can correctly floss your teeth. First of all, you want to choose a floss that would work best for you. Basically, the floss that I really like is Glide Floss. It helps me, it's easier to floss with, and it actually is better for your teeth. So you just want to break off a small piece of floss, probably about 1 foot long. You're going to wrap it around your index fingers. There's a couple different ways on how you can do this. You can wrap it around your middle finger or your index finger. I find it easier to wrap it around your index finger. And you're going to keep doing so until you come out with about an inch to ½ an inch long. Then you're going to take the floss and you're going to actually just push it down in between your teeth, all the way down below the gum line. And then you want to create what we call is like the C effect. You want to curve the floss around to actually make it look like a C, and then push it, go back and forth on your tooth and below the gum, and then pull it up and out. And you're going to do the exact same thing on the other side of the tooth. Push it down below the gum line, create a C effect, and go back and forth as you're pulling up and out. You want to do that continuously throughout each individual tooth and all the way back in between your molars also. And then you're going to when you're coming back on the very back tooth, you still want to floss that even though there's not a connected tooth next to it. So you're going to just, basically it's pretty simple. You just go back there, push it below the gum line, and then pull it, create a C effect, and pull up and out. You do that all throughout your mouth. Then to finish it off, you're going to want to brush your teeth afterwards, rinse around with antiseptic rinse, and then you'll be all set.
This picture right here is a good example of what would happen if you didn't brush and floss. I know no one wants their teeth to look like this. It sounds unlikely, but bad teeth, bleeding gums, and poor dental health can end up causing heart disease. Poor dental health can also result in gingivitis. Gingivitis is shown in the second picture. Gingivitis is an inflammation of the gums, which is caused by leaving plaque on the teeth for long periods of time. Not removing this plaque is what causes tooth decay. As you can see in this picture, the gums are very red and inflamed. The gum lines have receded, causing the root of the tooth to be exposed. In other cases, the gums may also recede like this from clenching the teeth, having diabetes, and also brushing too vigorously. Many people may wonder what makes up a tooth. This diagram shows the different parts of the tooth. The outermost layer of the tooth is called enamel. Shown in light blue, enamel is the hardest tissue in the human body. It surrounds dentin, which is showed in yellow. Dentin is the inner layer and main part of the tooth. Dentin surrounds the pulp, which is shown in gray. Pulp is the part of the inside of the tooth that contains the nerve. This nerve is what will tell you if the tooth feels pain. The root is the part of the tooth that secures it into the jaw.
Pregnancy brings about many changes in your body, but you may not realize that it could also affect your dental health.
We like to see our pregnant patients, preferably in the first and the third trimester, so that we can try to help them with any problems that they may have with some hormonal changes. Some of the common dental issues that pregnant patients will find is that their gums will bleed a little bit more than usual. Another thing that patients will experience during the last trimester is the loosening of joints. That includes their TMJ, or temporomandibular joint, which would be located right here. A lot of times what happens is that in the last trimester, as all of the joints loosen, their TMJ will also loosen. They'll find that their bite feels a little bit funny.
I was concerned about the safety in having dental work done during my pregnancy. In fact, in the beginning of my pregnancy, I noticed I had some bleeding gums. Dr. Warnock did a great job explaining dental care during pregnancy, and after I talked to her, I felt very comfortable about what to expect.
Like Dana, some women may be concerned about the safety of dental visits during pregnancy, but Dr. Warnock says that dental work can be done safely and could even prevent complications.
It's important for a pregnant patient to see a dentist as soon as she feels any pain in her mouth, mainly because if that is an infection, it can be passed on to the baby. And it's important for patients to see their dentist every 6 months. It's especially important if they have a history of periodontal disease. There is research that shows that there is a link between periodontal disease and premature or low birth rate babies.
Pregnant women should maintain their regular cleaning and exam schedule. If further treatment is needed, their dentist can help determine if the procedure is safe during pregnancy.
If it's something that hurts or if it's something that's necessary, we really want to make sure we get it done before it can cause any further pain for the patient. If it's something elective or something really small that may be able to wait until after the baby is born, we would like to do any elective treatment after that time.
Your dentist can also provide you with valuable information that will help keep your baby's mouth healthy.
A lot of first-time moms don't realize that dental cavities actually can be transmitted from their mouth to their babies. So I like to make sure that they understand that so that they know when they keep their mouths clean, they can actually decrease the chance of their child having cavities. Dental cavities can be transmitted from parent or from any caregiver to a child, from kisses, from sharing things, spoons, cups, and One big thing that I notice that parents will do is a pacifier will fall on the ground, and they'll pick it up, and there won't be any water around, and in order to clean it, they put it in their own mouth. What that does is it takes the bacteria from their mouth and puts it into the child's mouth.
For more information about dental care during and after pregnancy, contact Dr. Anna Jose Warnock at 891-2008 or visit warnockdentistry.com.
In conclusion, I found a funny song that I thought was perfect to go along with my project. Hope y'all enjoy.
I've been to the dentist 1,000 times, so I know the drill. I smooth my hair, sit back in the chair, but somehow I still get the chills. Have a seat, he says pleasantly, as he shakes my hand and practically laughs.